Biden submitted his budget on May. You know what? You made an accusation to me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can go
And I
down
also
that
want to
road.
point
I
out.
have just 2 minutes left. I asked you a specific
I want to
question.
point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
Seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary,
epidemic
I am here
of
to
chronic
ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about the epidemic
Mr.
of chronic
Secretary,
disease?
Seriously, Madam
Secretary,
Chairman.
I would ask you to hold.
Tensions exploded on Capitol Hill as Senator Patty Murray and Health and Human Services Secretary Robert F. Kennedy Jr. clashed in a fiery exchange that grew so heated the committee chair had to step in and restore order. What began as a budget oversight hearing quickly turned into a sharp confrontation over funding, transparency, and the future of America's public health system. Before we break it all down, make sure you subscribe to the channel. We translate moments like this into clear explanations so you understand not just what was said, but why it matters to your family, your health, and your tax dollars.
Thank you both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in childcare funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now, in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claim that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut," later going on to say there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and childcare. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another childcare issue. Secretary Kennedy, whose decision was it to withhold childcare and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation to me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can go
And I
down
also
that
want to
road.
point
I
out.
have just 2 minutes left. I asked you a specific
I want to
question.
point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary,
epidemic
I am here
of
to
chronic
ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about the epidemic
Mr.
of chronic
Secretary,
disease?
Seriously, Madam
Mr. Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about childcare. I'm asking you who made the decision to withhold childcare and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, "We were not cutting thousands of scientists, we are not cutting clinical trials." But I want you to know, in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue.
I will,
Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information
I agree.
anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff
Madam Secretary,
2 weeks ago.
Mr.
2 weeks ago, you were
Secretary,
corresponding.
seriously.
What you said you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Senator Hyde-Smith.
Thank you, Chair Capito and Ranking Member Baldwin, for this meeting.
Senator Murray opened with a blunt warning. She told Secretary Kennedy that things are not going well at HHS, accusing the department of devastating children, families, seniors, and millions of Americans who rely on federally funded health and social programs. Her frustration centered on accountability. Congress had required HHS to submit a detailed operating plan showing how appropriated funds were being spent. Instead, Murray said, the department sent what he called a Hill version, a document riddled with more than 500 asterisks where actual funding levels should have been. In plain terms, Murray was saying Congress could not see where taxpayer money was going. Subscribe now because this transparency fight affects everything from childcare to cancer research. Murray accused the department of blocking billions of dollars Congress had already approved, including funding for the National Institutes of Health, Head Start, and childcare assistance. She added that this was on top of billions more that had already been stripped away from state and local health departments, substance abuse and mental health programs, and Title X services that support cancer screenings, birth control, and preventative care. If you want coverage that connects policy decisions to real lives, subscribe here. Murray then broadened the stakes. She warned that deep staffing and funding cuts across HHS could surrender American leadership in biomedical research to China. That shift, she said, would mean future drugs, vaccines, and medical devices being developed elsewhere, with the United States dependent on foreign supply chains, the same kind of vulnerability exposed during the pandemic. Her message to colleagues was clear. Congress has spent decades on a bipartisan basis, building America's dominance in medical research. She accused the administration of setting the country back by decades and risking the loss of scientific breakthroughs that cannot easily be rebuilt once dismantled. Then the confrontation turned personal. This is where the hearing took a dramatic turn. Subscribe now because what happened next shows how quickly oversight hearings can unravel. Then he escalated. Kennedy told Murray that she had presided over Congress for decades and accused her of overseeing the destruction of Americans' health. He claimed the United States now has the sickest population in the world because lawmakers like her failed to address the epidemic of chronic disease. Subscribe because this next exchange gets to the heart of scientific research and patient care. Murray confronted Kennedy over his claim that HHS was not cutting scientists or clinical trials. She cited figures showing that nearly 5,000 NIH staff had been fired or pushed out in recent months, and that more than 1,600 NIH grants had been terminated, including hundreds of clinical trials nationwide. Her question was direct. Whose decision was it to fire scientists and terminate these grants? Kennedy responded by saying he did not trust her information and accused her of previously making false claims about a clinical trial in her state. The exchange became increasingly tense, with both sides disputing emails, timelines, and communications between staff. Murray accused Kennedy of coming to the hearing to argue rather than answer questions, while Kennedy accused her of knowingly spreading misinformation. At one point, Murray stressed that they should not be discussing patients' private medical information and refocused on the broader issue. She argued that regardless of disputes over individual cases, the administration was effectively enacting a budget Congress had not passed by cutting funding in real time. Her closing warning was stark. She said this committee would find such actions deeply detrimental in the future, not just politically, but to the nation's health, scientific leadership, and public trust. As the chair moved on to the next senator, the moment left behind a clear picture of just how high the stakes are. This was not just a shouting match. It was a collision between Congress's constitutional power of the purse and an administration accused of reshaping public health policy through unilateral action. Subscribe to stay informed, because these decisions will shape childcare access, medical research, and public health for years to come.